Let us learn treatment approaches to paranoia and delusional disorder. A cure of paranoia is very difficult and it is essential that treatment should be started immediately the disease comes to be known. And once it grows on a person, there is no curing to it. The chief method of curing is the treatment and cure, then psychoanalytic method, CBT, then drug therapy, combining pharmacotherapy with cognitive therapy, psychotherapy. It includes individual psychotherapy, CBT, family therapy. And first of all, you have to learn the treatment and cure. Cure is very difficult and it is essential that treatment should be started immediately the disease comes to be known. Once it grows on a person, there is no curing to it. The chief method of curing is administering injection of insulin. Some patients also respond to this treatment, but this cannot be said of all. Then psychoanalytic method includes this disease does not respond immediately to psychoanalytic treatment because being suspicious, the patient does not cooperate with the doctor or even then with the due precaution, certain result can be achieved by employing this method. In CBT or other forms of therapy may be helpful for certain people who have paranoia. CBT attempts to make a person more aware of his or her actions and motivation and try to help the individual learn to more accurately interpret cues around him or the effort help the individual change dysfunctional behaviors, and the difficulty can enter into a therapeutic relationship with paranoid individual due to the level of mistrust and suspicion that is likely interfere with their ability to participate in support groups, and here is helpful in for some paranoid individuals, particularly helpful in assisting family members and friends who must learn to live with and care for paranoid individuals. So we can see that the treatment includes this paranoia. This cure is very difficult, but once it grows on a person, there is no curing to it. The chief method of curing is administering injection of insulin. Some patients respond to this treatment. Then in psychoanalytic method, the disease does not respond immediately to psychoanalytic treatment because being suspicious, the patient does not cooperate with the doctor. Even then with the due precautions, certain result can be achieved. Then in CBT attempt to make a person more aware of his or her action and motivation and try to help the individual learn to more accurately interpret the cues around him or this help the individual. This effort help to change the dysfunctional behaviors, and it can be helpful for certain people who have paranoia by this difficulty can enter into therapeutic relationship with the paranoid individual and due to a level of mistrust and suspicion that is likely interfere with their ability to participate to form of treatment. Then support groups can be helpful for some paranoid individuals, particularly helpful in assisting family members and friends who must learn to live with and care for paranoid individuals. Then drug therapy. This treatment with appropriate antipsychotic drugs may be helpful with the paranoid patient to overcome some symptoms. And although these antipsychotic drugs may help the patient's functioning may be improved and the paranoid symptoms often remain intact. Some studies indicate that symptoms improve the following drug treatment, but the same results sometimes occur among patients who receive a placebo. That means a sugar pill without active ingredients. This finding suggests that in some cases paranoid evinces for psychological reasons rather than because of the drug's action. Delusional disorder treatment involves atypical, also called a novel or newer generation in antipsychotic medication which can be effective in some patients like risperidone, quetiapine, olanzapine are all examples of a typical or novel antipsychotic medications. This delusional disorder treatment involves atypical antipsychotic medications, and if agitation occurs, a number of different antipsychotics can be used to control the outbreak of acute agitation. Agitation is a state of frantic activity experienced concurrently with anger or exaggerated fearfulness increases the risk that the client will endanger self or others. Then, to decrease the anxiety and slow behavior in emergency situation where agitation is a factor, an injection of haloperidol or Haldol is given usually in combination with other medication, often lorazepam, also known as Ativan. Agitation in delusional disorder is a typical response to severe or harsh confrontation when dealing with the existence of delusion. It can be a result of blocking the individual from performing inappropriate action the client views as urgent in light of delusional reality. A novel antipsychotic is generally given orally on a basis for ongoing daily basis for the treatment meant for long-term effect. And response to antipsychotic in delusional disorder seems to follow the rule of third, in which about one third of patients respond somewhat positively, one third show little change, and one third worsen or are unable to comply. So, this therapy has been, cognitive therapy has shown promise as an emerging treatment for delusion. The cognitive therapist try to capitalize on any doubt the individual has about the delusion, then attempt to develop an effort with the sufferer to generate the alternative explanation. And this examination proceeds in favor of the various explanation. Much of the work is done by use of empathy, asking hypothetical questions in a form of therapeutic Socratic dialogue, a process that follows a basic question and answer format, figuring out what is known and unknown before reaching a logical conclusion. So, drug therapy includes antipsychotic drugs which help the paranoid patient overcome some symptom, and this delusional disorder treatment involves atypical antipsychotic medication, risperidone, quetiapine, olanzapine. Then are the examples of novel antipsychotic medication. If agitation occurs, number of different antipsychotics can be used to conclude the outbreak of acute agitation. Agitation with anger or exaggerated fearfulness increase the risk that the client will endanger self or others. To decrease the anxiety and slow the behavior in emergency situation, an injection of haloperidol is given, usually in combination with the other medication like lorazepam. Then agitation is a typical response to severe or harsh confrontation when dealing with the existence of delusion. It can be a result of blocking the individual from performing inappropriate action the client views as urgent in light of delusional reality. Novel antipsychotic is generally given orally on a daily basis for ongoing the treatment for long-term effect on the symptoms. Then this therapy has shown promise as an emerging treatment for delusion. Much of the work is done by use of empathy, and then we learn the combining pharmacotherapy with the cognitive therapy. The integration of both the treatment may be in the possible underlying biological problems and symptoms can be reduced with the psychotherapy. Psychotherapy is the primary treatment for delusional disorder, including psychosocial treatment, which can help the behavioral and psychological problems associated with the delusional disorder. Through the therapy, patient also can learn to control their symptom, identify early warning sign of relapse, and develop a relapse prevention plan. Psychosocial therapies include individual psychotherapy, CBT, and family therapy. Individual psychotherapy can help the person to recognize and correct the underlying thinking that has become distorted. Then CBT can help the person learn to recognize and change the thought pattern and behaviors that lead to troublesome feelings. Family therapy can help families deal more effectively with a loved one who has delusional disorder and enabling thus to contribute to a better outcome for the person. So this combining pharmacotherapy with the CBT is also can be reduced with the psychotherapy. Symptom can be reduced, and the psychotherapy is the primary treatment for delusion disorder, including psychosocial treatment, which help with the behavioral and psychological problem associated with delusional disorder. And through therapy, patient can learn to control their symptoms and to identify early warning sign of relapse and to develop a relapse prevention plan. Psychosocial therapies include individual psychotherapy, cognitive behavioral therapy, and family therapy. Okay, bye.